Hi, my name is Yousef Odeh. I'm a cardiothoracic surgeon at St. Mary's Hospital, and I work with Carondelet Medical Group. You're listening to this video because you need heart surgery. We also have a booklet that reiterates everything that I'm going to say. Therefore, if you have any questions, you can go back to watching the video or reference the handbook. If you're having this operation, one of two avenues. Either you're in the hospital and you're having this semi-urgently, or if you're coming to see me in the office, you're having this electively. If you're having this electively, in the booklet, it'll show you areas where you can park and where your family can park. And you'll be notified by the hospital, usually a few days before your operation, by the department PAT, pre-admission testing. And they will contact you and they will have you come in and your blood will be drawn, EKGs and chest x-rays will be done. If you're in the hospital as a patient, this will be done as well. If you're having this operation electively, my clinical staff will tell you which medications need to be stopped, and they'll be only reinforced by the pre-admission testing. They will tell you when to stop them and how they should be stopped. If you are having this operation in the hospital, that is, you're a patient in the hospital, your physicians will be able to control that and monitor when you are getting the medications and when they need to be held. If you're notified by the pre-admission testing to come to the hospital, there'll be a list of things you should take with you. Items are listed in the book. They include a buddy, photo ID, a list of your medications, a list of physicians, and a list of emergency contacts. There are multiple heart operations that can be performed. Most oftenly, it's coronary artery bypass grafting or valve disease and the valve replacement. Those are the two big operations performed by cardiac surgeons. Regarding these operations, I will speak to you directly and to your family about the operation individually. Regarding each operation, we'll go over the risks and benefits of each operation, and where they differentiate is upon discharge and how things will be managed at that point. And at that point, you'll be given individual booklets on the discharge, teaching from that point on. The day of your surgery, you'll be brought to the ICU. And the ICU has dedicated cardiac beds, which means that the ICU is made of 34 beds. However, a portion of that is just dedicated to the cardiac surgery patients. It is managed by a 24-hour intensivist. Therefore, an intensivist will always be available if needed. When your operation happens, you'll come into what we call the preoperative area, and you'll be greeted by the nurses, the anesthesiologists, and various people that will be involved in your operation. Throughout the operation, we will be contacting your family members to let them know about the operation and how things are progressing. After the operation, you'll be in the ICU. When you're in the ICU, you'll be brought to the ICU asleep and with a breathing tube. And as time progresses, usually 4 to 6 hours later, you wake up and you're able to be strong enough where the breathing tube can be taken out. You'll recover in the bed for the rest of the day, and usually the next day you're up, out of bed, and walking. At that point, you'll interact with myself or my physician assistant. The first days post-operatively, we're trying to increase your nutrition and trying to increase your ambulation. Every day we'll be working towards that, and you'll be taught how to ambulate, how to become independent. Ultimately, our goal is that on the 5th day, when it's time to go home, you'll be ready for independent living. And from the ICU, after you're stable, you'll go to a different part of the same area called the step-down area. There, you'll ultimately be discharged from that area and you'll be able to go home with loved ones. Prior to discharge, usually we have a meeting with you and your family members, and we talk about discharge at that time. We go over your medications and things you should be aiming to do and things you should not do. Also, at home, we offer many things depending on your qualifications. We have home health, we actually have skilled nursing facilities, and inpatient rehab if needed. On the day of discharge, we go over your medications and when they should be taken and things you should be looking out for. We go over those issues with you and a significant other if they're available. You'll be given a discharge appointment. That is an appointment to come to the office. It's usually within 1 or 2 weeks after you get discharged. At discharge, you'll be given a sheet that has an area where you can log your blood pressure and your heart rate. And you should be doing that twice daily, usually 7 a.m. and 7 p.m. And it should be done daily and brought with you to your follow-up appointment. That allows us to be able to control your medication if needed. After you get discharged, there are a few things that I really want you to know, and that is wound care. We do not want the wound to be submerged in water. That is, do not take a bath, don't go in a pool. However, we do want it to be clean. So take a shower daily, and we really want you to be walking. We don't want you to be, what we say, a couch potato. We actually want you to be walking 2 or 3 times a day, and we'd like this to be outside if possible. In terms of diet, we want you to modify your diet upon discharge. We're not so much concerned about the fats and the carbohydrates, but we do want you to watch your sodium intake. Everything that comes in a can or a box has a lot of sodium. We try to minimize the sodium intake. We try to limit the sodium intake to 1,500 milligrams a day. Yet this will not be permanent, but this is the initial, probably 4 to 6 weeks we like to see that. So things you want to be eating are things that are actually made at home. A lot of fruits and a lot of vegetables and things that are generally not store-bought and definitely not takeout food, because all of that has a lot of sodium within it. So upon discharge, there are a few things I do and do not want you to be doing. I don't want you to be driving for the first 6 weeks. I don't want you to be exercising yourself to fatigue. However, I do want you to be walking daily. I want you to wake up each morning, put on your own clothes, and when you're in the hospital, the respiratory therapist will teach you breathing techniques that can help you prevent a pneumonia, and the physical therapist will help you with techniques in getting around and ambulating. After cardiac surgery, you're at risk for heart failure, or you may already have heart failure. And if you do, then you'll get additional teaching at the time of discharge. Some of the things to watch out for are your weight gain, sodium intake. You could be swollen around the ankles. You could have shortness of breath or persistent cough that is concerning to you. At that point, let my office know that these are concerning things. Things that should alert you to come to the emergency department directly would be any fever, redness or drainage from the wound, nausea, vomiting, diarrhea, or inadequate pain control. Thank you for watching this video, and we have a great staff, and I'm excited to take care of you. We have been doing this for a number of years, and we do this routinely. I want you to know that we've got a lot of information. However, this information will be given to you in the form of a booklet at the time of discharge. The staff and me are always available to you. At the time of discharge, you can reach out to me or my physician assistant, and we'll be able to answer any questions that you might have.